their background so that I can do right now. I wanted to talk a little about my father's battle with leukemia. Approximately 3 years ago, he had a stroke. Well, it was about 120, I think, with the heat index, with almost 100% humidity. I think it was 107 or 110. Anyway, he said he fell down. He could hear, but he couldn't talk. His mouth was stuck, he said, like halfway open. And somebody found him and called the paramedics. And what I was told is they airlifted him to the neighboring city. And I think he was hospitalized for 2 weeks. He regained most of his mobility. I think he was tired, and what I think causes leukemia is a blood disorder in the bone marrow. Teeth are specialized bone. I think with his mouth open at an angle, it may have only been 20 minutes. It may have been an hour and a half. I'm hearing conflicting stories. I don't know where the paramedics seen, but they airlifted him by helicopter to Greenville, and I think the UVC that causes the cancer was absorbed through his teeth. The reason I think this is because he hasn't had teeth problems in probably 20 years. I'm sorry, 40 years, maybe 50. And he was tired ever since, and he ended up having one tooth pulled approximately a month ago, and he thought that was going to be the end of it. They admitted him straight because of his vital signs to the emergency room into the hospital, and that's where he was diagnosed with leukemia after he had a tooth pulled. I don't know if he absorbed through that tooth, through a spot where there used to be a tooth next to it, a fake tooth. I don't know if he had a tumor in his jaw or in his gum. As far as I know, that was never checked. I've heard several cases, and I personally experienced doctors that say, we know nothing about teeth, go see a dentist. And if you go see a dentist and you have any problems other than some of them will say your gums or your mouth, then you need to go see a doctor, that they don't know anything that the doctor knows. Doctors don't know everything. My advice is not to give up. If they did, you wouldn't get sick and nobody would ever die. There's very little that they know. Through my research, he went to the emergency room. I think the first time, I can't remember what his hemoglobin was. I want to say it was a 7 out of I think a scale of 1 to 14, maybe 1 to 16. And what did I do with my pad? They gave him a blood transfusion, which I would not recommend because it's giving you false hope. It's only going to bring your hemoglobin up a couple of points at best. I think he did 2 of those. Yeah, I know he did. He did 2, and he did 2 of the transfusions, and he probably could have done the 3rd one, but I don't know what he would have done with just 1 more day. Eventually, the person's blood, from my research, now hopefully an oncologist or a geneticist or a cancer researcher can clarify this. This is not medical advice. This is just from my own research, several hundred hours so far on the internet. That it will raise your blood hemoglobin score a couple of points. I think the last time they said it was a 4, and they got him up to a 6 with, I want to say, 3 pints instead of 1 or 2. 1 the first time, I think, and 3 the second time. The 3rd one, apparently the person's blood gets so depleted of healthy blood cells that have the hemoglobin that combine to the oxygen that you could run them around with an IV drip or a permanent transfusion, and there wouldn't be enough of the blood cells to carry the oxygen, to make energy, and to make more of themselves, that they get deformed. There's something called the p53 protein. Its job is to monitor proper blood cell production, and it latches onto the DNA from what I found in my research, and it looks at it based on shape, and it determines that if it's healthy, it goes through. If it if the cell is not properly formed, not fully developed, then it can either say this one can be repaired and sends it off like another assembly line to have it repaired and completed into a healthy cell. If it's very much lacking, it can't be fully formed, then it says recycle the parts of this that you can and start over and send me another one down the line. But when that protein absorbs the UV wavelength of, they call it UVC radiation, it bonds to tyrosine genes. It bonds them together. It's not a weld. It's I don't know. I guess it's a covalent bond. They share a charge, and it holds them together. And when that happens, the protein, that P53, can attach to the DNA to read. So it's less cost efficient. I mean, less costly for the body to produce the underdeveloped blood cells, and they go through, but they're not, since they're not fully formed, the hemoglobin can't carry the oxygen. There's hydrogen. There's iron molecules in the hemoglobin. There's 280 million in each red blood cell that somehow house an iron molecule that the oxygen bonds to where it's not toxic. Normally, iron in the blood is toxic. And they have something called photolase. It's an enzyme that breaks that bond between the two T's so it can go back to its normal shape, so it can attach once again to the DNA and do its job. And that photolase is activated by any wavelength of light, visible light. So my idea is if the radiation was absorbed through his teeth, it was missed, and that's how it got in his bloodstream, that you can maybe, I don't know if any researchers, hopefully somebody will see this and be able to tell me, if you could put the photolase that they use, the enzyme for skin cancer, in a dental tray, and then prop the person's mouth open so it's exposed to light, that will be absorbed into the bone, into the bloodstream, and get to the bone marrow where that irregular bond is, where the one gene jumped from one to the other, from the X, in my father's case, from the X chromosome to the Y chromosome, where it shouldn't have been, that caused that the deformity or the lack of full formation of healthy, mature, fully developed red blood cells. And what happens is the next stage is the person starts losing energy, and the bone marrow starts producing those defective blood cells or immature ones, and they squeeze out the white blood cells and the platelets. So then the person can be infected because white blood cells is most of your immune system. The platelets keep you from free bleeding, so we had to monitor that, make sure that he didn't get any cuts, that if you had a minor cut can bleed out like an artery being ruptured. And eventually the person's body goes into overdrive thinking that it needs red blood cells, is not aware what the P53 protein can't do its job, and ramps up production to make as many red blood cells as can. The person at that point thinks they need oxygen because they're not getting in their lungs, and the problem is their lungs are working perfectly fine. It's the oxygen, the hemoglobin is not fully formed in red blood cells, so that oxygen can't attach to make red blood cells fully formed and to get energy to the rest of the body, and eventually it shuts down, and that's how my father passed away. So I don't know if anybody's tried the dental tray. Another thought I had is there's one other technique, another enzyme that rakes out, it just removes several genes, and then the body forms them back, but sometimes they're not in the proper sequence. So I don't think that's a better fix. Or if you could, they took a bone marrow sample, if you could inject this is all the enzyme does, the photolase into a person's bone through a needle, and then have another microscopic light that will pulse or stay on where that is injected, if it will unbind the p53 gene, this may need to be an ongoing process, some kind of a permanent stimulation wherever the majority of the red blood cells are made, instead of doing a bone marrow transplant. Now, I was told my father wasn't a candidate for that, but I found a place in Roswell, New York, that said that they could do it, that they've had people in the last couple of months that have survived, that's had a bone marrow transplant in their 80s, which my father was. They said he would, everybody else is out on the operating table. Apparently, this one medical center has added 2 or 3 steps and somehow has kept people in their 80s alive through the procedure. They also said he had kidney damage before that his kidneys couldn't take it. As far as I know, they're harvesting kidneys in Nepal. They're literally stealing people that are matched for, and you can have them installed for $1,500 or $2,500 in India. So I don't know why that wasn't an option. In India, as far as I know, they're doing it voluntarily, and you can live perfectly fine with one. I'm not aware of any other medical conditions that he had. His oncologist, my siblings got to see him. I still have not seen the guy. I tried to see him after hours. He said he had patients. I can't imagine what his life is like. An oncologist probably has, I think somebody told me he has 10 patients a day dying, and it's going up. He has several hundred patients. I'm not going to mention his name, but he wouldn't visit with me. I wanted to ask him about some of what I just went over. I went to the clinic department. They had me see somebody in the administration department, not an oncologist. A researcher was supposed to call me back today and never did. My father will be gone a week and a little over 9 hours. So hopefully there's something in these videos that will help you. I can't bring him back, but hopefully I can help somebody else from having to pass away the way he did. I wanted to go over some of the hospice care. He did die at home. But I really wanted to touch on the medical research that I've done so far. There's still a little bit more that I'm looking to view, mostly through YouTube videos. I've been working on this for a few hundred hours over the last couple of months. My favorite researcher so far, if you want to look her up, is Eleanor Shekey. It's Shekey. I thought my father had amyloid leukemia. Now they're telling me it's some other form, but that this driver problem with the p53 protein is responsible for 60% of all cancers. I always thought my father would die from a heart attack like his father did. But he was really healthy. I got a Smartwatch to monitor him kind of as he passed away. My brother, one of my brothers and my sister was the main ones monitoring his care. I think they did a better job being able to take the stress of watching him pass away, and there was nothing we could do. They gave him 3 different medications at hospice care. One was for vomiting, which was really, I think, his lungs trying to clear themselves. I don't know if there was any side effect, but he only took that medication once. He's supposed to have had it every 4 hours. Another medication was for anxiety and relaxation, which he never took. I don't know why. I tried to make him some bone broth with garlic, thinking that that would be a mini spike for like a blood transfusion. They help him ease down the other side. When this is the day before he died, when he had no energy, he would kind of, I'm going to make this in another video, he would kind of go in and out. He would wake up maybe a few minutes every hour or so and ask what time it was, and for a little bit of Dr. Pepper and ice. I don't know why, but that's what he wanted. The last thing he ate was watermelon and some cantaloupe. Again, I don't know why he wanted that. I tried to get him to eat sea bass. I couldn't find any of those because there's supposed to be a special diet for leukemia that helps. And salmon, as far as I know, he didn't eat that. I made some special bone broth. I found a recipe for off of the internet. I think it cost me about $50 for the ingredients. And it took 49 hours in the pressure cooker to make. But he wouldn't touch that. And it was kind of nasty, but I mixed it with some soup to where you couldn't taste it. And he never touched it. I don't know why he wouldn't, but he only wanted watermelon and cantaloupe, which I read another book called Your Right to Be Beautiful, that you should start eating seeds, which I do. Even ones that are hard, you might be able to crack open and get meat out the inside. I heard metformin's good. Some people say that there's side effects. Some say it's just for diabetes. I've heard one guy that say that they're going to outlaw it, and another guy say on the internet that they're going to start sending everybody in the U.S. on their 60th birthday starting in 3 years. So we'll have to see. But this is my father. I'm probably going to use this as a screenshot because it's difficult to see here. I bought a smartwatch. It worked better than advertised when I updated it and put him on him. This is his stats the day before he died. His heart rate was 51 beats per minute. His blood pressure was 118/75, and his oxygen level was 97, which this only reads up to 99. It may be a little inaccurate. He's never had any lung problems other than pneumonia. He had the lowest lobe debrided, so maybe that's where the 2% came in. There was just very minor scarring. I think he had pneumonia. I want to say that was 5 years ago, maybe in 7. But I think he kind of gave up at the end because people gave up on him. He said the doctor was all doom and gloom, saying there was nothing you could do. If he did absorb the radiation, have the problem in 2019, he didn't do a lot for the last few years. I don't understand why he lived the way he did, made the choices he did. He basically was a real estate investor and managing properties. I think that was his favorite thing to do, is go around and talk to the tenants about the houses and collect rent in the end. But I got to take him to do that 3 days before he passed. I think it was the last day that he really had energy to move. But that was really the only kind of symptom, other than a little bit of coughing a couple of days before and not having any energy was the symptoms. I mean, it's one little thing that can go wrong in the body, just one gene out of place, and that's all it takes. You can't, the person's not able to live. Thank you for listening. Please send this to a researcher or an oncologist if they can clarify anything that is said. I guess you can let me know if you have any questions. This is kind of cathartic for me, one of the ways for me to grieve that he's gone. The grief for me is come in waves. I'll get emotional and I'll think about something that reminds me of something he did for me as a child, or just the way I think he would think about something. So I miss him, but I know where he's gone, and I think the medical community did everything they could, but I don't know why there's not any more cooperation between dentists and doctors. That really bothers me. I've experienced that on my own. I've talked to several other people that said the doctors know nothing, the dentists know, and the dentists know nothing, the doctors know, and they just don't collaborate. I think he might have had a problem, like I said, absorbed it through his mouth, through his gum. I don't know, because of his age. He was 82. If that had anything to do with his gums, but as far as I know, his mouth was healthy. I don't know if they checked his mouth for a tumor. It bothers me. I want to learn more about which tooth was pulled and what they did at the dentist's office, if they sent him to urgent care from there, and then the emergency room, and then he was hospitalized for a while. And they told him he could come back for blood transfusions, but there was nothing else he could do. I do not recommend those. You're just buying time at that point. It might have gave him an extra 3 or 4 days at most, but it's not a cure. It's not really even a treatment. You're literally buying time at that point. I think it gives the person false hope that they get some of their energy back. And it's just like, I don't know, it's like a caffeine hype when you know you're going to pass out and go to sleep. But he's permanently sleeping now. Thank you for listening. I'm going to try to divide up some other videos. I hope this is not long and rambling, but I wanted to put this information out there to hopefully help somebody else and continue the research. Thank you.